Doctors and nurses of Reddit, what have been your why didn't you come in sooner moments? Once had an older lady call in wanting a prescription for pain meds because she was sure she had shingles. Said her neighbor had them and she was sure that's what it was. She hadn't been in for an exam in almost 2 years, so the doctor asked that she come in to be evaluated before a prescription could be given. She refused and called again the next day asking for a prescription. This went on all week. Her calling for pain meds, the doctor asking her to come in to be seen. She finally agreed to make an appointment. It wasn't shingles. It was a skin ulceration from advanced breast cancer. Why is it that older patients are always so stubborn? I've seen a few over the years, and they generally fall into the category of if it's not diagnosed then I can't have it, or I didn't think it was that bad. As a medical student, I remember an older lady that had a breast that was necrotic and falling off. It had been progressing over the last several years. But, if she didn't get diagnosed with breast cancer, then she couldn't have it. In the other category, I've seen a few cases of Fournier's gangrene. Pretty much obese, male diabetics that had a pimple/sore that started in the pubic region. By the time they come to the hospital, it's a raging infection where the treatment is basically to cut away everything in the pubic/groin region down to the muscle layer. That little sore didn't seem like much at first. I lost an elderly friend to that mindset many years ago. Despite 6 of her 7 siblings having died from some kind of reproductive, genital cancer, she never had a smear test, and ignored a pain that started in her womb region and spread out to her lower back. She'd just tell us she had sciatica. It wasn't until the cervical cancer was literally growing out of her that she admitted something was wrong. After the diagnosis, she just gave up completely, refused to eat. It was over in a couple of weeks after that. She was an exceptionally stubborn woman. That was my mill. She had a mass on her breast the size of a large piece of fruit that was eroding through the skin. She told everyone that the pain she was in was from arthritis in her shoulder. My sil finally made her fess up to the mass that had been there for years. It was so bad that she was immediately sent to the ER by her GP so she could be more swiftly admitted. She was given Dilaudid due to the severity of the pain. Obviously it was stage 4 metastatic. She miraculously lived another 18 mo at 70. Her excuse was due to losing her own mother to ovarian cancer when she was 19. She had herself convinced that cancer treatment hadn't changed in 50 years. Coworker was having issues for months with eating and indigestion, then she had started throwing up everything, liquid and solid, for a week. Another coworker convinced her to go to the ER, and I went with her. Ended up her intestine was twisted and she needed emergency surgery. She waited so long because her mom died in a malpractice incident when she was a teen and now she doesn't trust doctors. I worked with a guy who had to take a week off from work because he wasn't feeling very well. He came to work and was looking very yellow. We told him that he needs to go see a doctor. Turns out he had lung cancer that spread to his liver, which was causing him to turn yellow. About 5 weeks later he died. My dad also had colon cancer back in 2015. He was having cramps and he said it was just the coffee he had been drinking. After a while he started to see blood when he would use the bathroom. He immediately went to the hospital. He's doing a lot better now. Not a doctor/hospital staff, but my grandpa ended up passing away because he waited too long before going to the hospital. This was about 17 years ago. He was tending to one of his mules when something spooked it and he got kicked in the gut. He was in a lot of pain, could barely move due to the abdominal pain, so decided to take it easy and lounge on the couch for a week. He refused to go to be taken to the hospital. Unfortunately, that mule kick ruptured an unknown tumor in his intestines. The doc said it was huge, like volleyball size huge, and he may have survived if he came in sooner. By the time we got him to the hospital he had a severe case of gangrene. His leg needed to be amputated within a day of him being there. He passed away a week later. My grandfather was a stubborn old man too. I finally got to the point with him that I'd give him a choice between being driven to the hospital by me or taken there in an ambulance, but he was going whether he liked it or not. We once had a patient who went to emergency for abdominal pain and they discovered a fungating breast wound, don't image search that she'd had for 2 years and hadn't gotten medical attention for. A biopsy and a PET scan later she was diagnosed with breast cancer with extensive liver, lung and bone mets. This was also in Australia, so it wasn't a money issue. Just sad. Image search that. Highly regret it. Edit, r/I bleach, for those of you who need it. Reddit link. Well, now I'm curious. Edit, unless you feel like skipping a meal or two, don't image search this. No one is explaining what it is and I'm kind of scared to look it up, so could you explain it? It's like gangrene but with lichen looking bits. If you've ever looked up radiation ulcer, you'll be fine. Children's nurse here. My first week in pediatric ed, we had a young girl, 6/7, come in with a really swollen jaw/face. Poor girl was unable to move her jaw without intense pain and hadn't been able to eat for several days. Turns out she had only just started cleaning her teeth for the first time ever and managed to develop several abscesses and rotten teeth in the process. To make it worse, her mom told us she was recovering from the same procedures to remove most of her teeth because of almost the same thing. They didn't want to bother the general practitioner as they thought she was just messing about to get out of school. All of a sudden I don't feel quite as terrible about the cavity my 6-year-old has to get filled. That poor little girl, this breaks my heart. There are people who develop cavities much easier than others. Even with proper mouth hygiene, it still happens, no need to worry about not being good enough. There is also a huge difference between a cavity and a rotten tooth. Rotten teeth have been left uncleaned and untreated for quite a while, so I think that's where parents actually should feel bad. Yep, I've always had good toothbrushing habits and still ended up with cavities almost every time I went to the dentist. Conversely, I take poor care of my teeth even though my grandfather was a dentist and never had a single cavity after 30+ years. No gum disease either. Every dentist I've seen since my grandfather stopped practicing has said the same thing, good genes. Edit, fix spelling error. Is this not child abuse? Yes, I believe it is child abuse. Not letting your child go to get help is child abuse. Had a patient brought in by her son who took care of her. When she arrived to our unit, I performed a skin assessment, took off her socks and found a fallen off gangrenous toe. Seems fake and I wish this was, but it was by far the nastiest thing I've witnessed. Son said he had no idea when his mother's foot became that bad. No words. Our X-ray professor told us this happened to her once too when she removed a person's sock to X-ray their foot. Hasn't happened to me yet though. When I read gangrene or diabetic foot or osteomyelitis in the medical history for any foot X-rays, and the patient has socks on, I don't take the sock off. Image is just fine with the sock on. The smell usually tips you off regarding how bad it is. Also, if it looks wet. I don't want to remove the socks and find out that chunks of skin is going to come off with the sock. You'll be blessed one day, fear not. If you put the toe under your pillow, do you get blessed by the toe fairy with wonderful gifts? Edit, why in the world is this nauseating thought getting so many upvotes? If I put a rotting geriatric toe under my pillow, I better get a bottle of scotch old enough to legally have sex with. I'm using I better get a bottle of scotch old enough to legally have sex with regularly now. I hate this because half the time, the family is trying their best and simply overwhelmed with the level of care their family requires. Then sometimes they visit mama once a day and say you good? And act like they're infallible. Then sometimes they visit mama once a day and say you good? And act like they're infallible. Serious question. At what point can I no longer trust their answer? They are still legally independent adults. It's a complex answer that's different for everyone. From what I've seen as a nurse, it's the little things. Not taking a shower every day, finding them in the same clothes they wore the day before, losing weight because they don't feel like eating / the food they eat is garbage, medication mishaps, forgetting to take them, taking too many / not enough. Keep an eye on their teeth, their skin, and their hair. Listen to what they say. I think I stepped on something the other day, but I looked and I couldn't see anything. 3 days later you notice a large sore on the bottom of their foot where they couldn't bend over to see. Watch their elbows and heels, the place right above their butt if you can. Bony prominences develop bed sores awfully quick when all you do is lay in the bed / chair all day. Mobility is a huge factor in senior health. Lose that and things can go down quickly. Watch for loose cords, unstable rugs, worn down shoes. Clear their yard of leaves. This time of year is horrible for older people as things are getting slippery. I am currently sitting and waiting on my fourth patient who has fallen and broken something to come out of their oar. It's not just the shower and the dog that trip people up. Like I said, everyone is different, but you have to pay attention and not be afraid of addressing something and making a big deal out of something you know is off. No, talking about how grandpa's breath smells like death and his teeth are caked in breakfast and lunch and dinner is uncomfortable and you don't want to hurt his feelings, but it could be he forgot or he just isn't caring anymore. Things that can be hard to talk about need to be talked about with old folks. I'm just a nurse and I'm sure there's plenty of healthcare people and caregivers who can summarize it better, or more clearly. Not just a nurse. You're a health professional and everything you've said is bang on. Please don't diminish your profession. Thanks, Boo. I also just love little old people. They're an especially vulnerable bunch and we need to have better resources to be able to take care of them. This nearly happened to my mother-in-law. My father-in-law was her caregiver and after he passed, she tried to make a go of living alone. We were 60 miles away, as was my wife's brother. We had a daytime caregiver coming in to cook and clean, but it became clear in very short order that she needed more care than that. It was a relief for all involved when we finally got her into a nursing home. Maggots. Whenever it's gotten to the point of maggots, it's like 100 alarm bells that this person's living situation is no bueno. Maggots in the abdominal/genital skin folds of a morbidly obese woman who refused to let her daughter take her to the doctor until the smell was so bad the neighbors complained. Saddest, grossest patient issue I ever saw. And she was inpatient for weeks, with Q4 dressing changes that needed at least 4 people to assist. Awful for her, awful for us. Holy F, the neighbors could smell it? Jesus, I gagged. Probably an apartment, rather than the house you may have pictured at first read. Could have been a farm out in the country. Neighbors downwind hate her. My father-in-law used to be an ambulance officer and he's definitely certain the time a swarm of flies flew out of an old obese woman's genitals was the worst thing he's ever seen. One time I removed my patient's dentures and there were maggots in his mouth. He was also extremely malnourished. We ended up calling APS. My cousin is a pathologist assistant and was telling me how she had to dissect a testicle that was 11 pounds. Turns out it was testicular cancer. A lot of times young men will come in complaining of a cough that won't resolve. Usually the doc will ask if either testicle is swollen or the guy will say, well yeah, now that you mention it. They won't come in for a swollen testicle but they will come in for the cough. Unfortunately by that time, the cancer has already metastasized to their lungs. Edit. Okay guys, please touch your balls on the regular. Especially if you're a young guy. Don't be shy and speak to your doctor if something feels amiss. Hold your penis out of the way and examine each testicle separately. Hold your testicle between your thumbs and fingers with both hands and roll it gently between your fingers. Look and feel for any hard lumps or nodules, smooth rounded masses, or any change in the size, shape, or consistency of your testicles. I was just hanging out with a friend with an 11 pounds baby. His testicle was the size of a 4-month-old child. How could this patient walk? How could he sit down? How could his scrotum bear that weight? Web link. I'm not clicking that link. Completely suitable for work and I got a good chuckle out of it for what it's worth. Fear not, friend. Thank you. Click the link and indeed got a chuckle. My mom usually gets a 12 pounds turkey at Thanksgiving. Dude was walking around with a nut the size of a damn turkey. Epping hell. Thank you for watching. If you like our videos, please like them on YouTube. And share them with your friends. Please subscribe to be the first to know about Red Rabbit Reader's new videos. We welcome your comments below. Another of our videos will begin shortly.